Secretary McDonald, let's start with you. This is a broad question, if you'll allow me, but coming to government from private industry a couple of years ago, how do you go about trying to get so many patients, so many people in your system, the best possible care, uncompromising care?
Well, Jeremy, we're in the midst right now of the biggest transformation in our history. We call it My VA because we want every veteran to think of the VA as their own, customized for them, just like you'd think of your cell phone. 5 strategies. We got to improve the veteran experience. Secondly, we have to improve the employee experience because they're the ones who care for the veteran. Third, we've got to improve our internal support services. Fourth, we have to create a culture of continuous improvement. And fifth, we have to work with strategic partners like Dave and TriWest and like Barbara and Give an Hour. Making progress in terms of the last couple of years since the crisis. We've had over 7 million more completed appointments. 4.5 million have been in the community with partners, 2.5 million in VA. We've added 4 million square feet of new space, which means more access, 1,400 more new doctors, 2,300 more new nurses, evening clinic hours, weekend clinic hours. Obviously, we have more work to do. We've been able to drive down our disability claim backlog by about 90%. It was a peak of 611,000 in March of 2013. Today, it's about 75,000. And importantly, we've been able to house about 360,000 veterans and their families who could otherwise be homeless. We've taken homelessness down by about 36%. Sheltered homelessness down by 50%, but we've got more work to do. And it's about hiring more doctors, more nurses, and particularly in the mental health area, we really have some issues. We don't produce enough mental health professionals each year, so we're working with Congress to get more residencies to do that. We're working with our 1,800 medical school affiliates to put more people through mental health training. We've got a lot of work to do to create a system that can care for veterans.